The furnace.
The furnace. Put it in the oven, and it was super cool.
He put his pizza in the furnace.
That may have explained why mine was a little bit.
Yeah. All right, let's head over to the KUAM News Zoom room where we have standing by the public affairs officer for the Guam National Guard.
I'll just do it.
Mark Scott, live from the Infusion Center in Manilao. Good morning, Mark.
Hey, good morning, Chris. How you guys doing? Bree, Jason, Joser, half a day.
Good morning,
We're
Cap.
doing all right.
Oh, yeah, we're down here at the Manilao Senior Center with some familiar faces. Good morning, guys.
Hey. Hi, Daniel.
Oh, hey, whoa,
There's your
whoa.
boy. There's your boy working hard out here.
He sure is.
To
Daniel
justify his paycheck.
Daniel Paris from the KUAM
Yep.
News team.
Yeah, he's talking to some of our FEMA contractor folks who are here helping us at the monoclonal antibody treatment clinic, the Senior Center in Manilao. There's Doc Lewis behind me, just about to get started here on their day.
Right. It opens at what, at 9?
Yeah, you open at 9, right, Doc? Yes. Yep, he says yes. There he is.
Good morning, Doc.
Good morning, everyone. Good morning, Link.
Yep. You know, it's been a while since we saw you. I think it was on opening day for the Infusion Center. How has the flow of patients been?
It's been steady. We do hope that well, maybe not hope, but people that are positive, that we hope that they get the treatment that they need. And what message I want to get out there is that if you're positive, please come in early and don't wait till you're getting worse. Because what we're finding is people who are waiting, they come in, we assess them, and their oxygen levels are already low, that they require hospitalization. So this treatment is meant to be given early in the course of the disease so that you can get better faster. It prevents you from getting worse and preventing you from being hospitalized. So we don't want to, unfortunately, we have to turn people away, but fortunately, we send them to the emergency room and get the treatment that they need at the hospital to prevent another death.
Right, Doc. Doc, do you think there's ways that we can kind of tighten up the process between the testing and the treatment? Because when we identify the positives, right, that's where probably we need to reach them and tell them about the treatment option?
Yes, so the Guard and the Public Health have been doing identification at the TGen site. We are talking with the other testing sites, and they have been referring people steadily. So the word is getting out there. The first 3 days when we opened last week, we only had less than 10. Now, these past 4 days, we've been getting 15 to 20. So people are aware, people are asking for the treatment. The clinics are aware, they're referring their patients. So it's steadily getting there, and we hope hope to treat more patients that need this treatment. And this treatment has proven to be effective. Every patient that we've called that have gotten the treatment for follow-ups, they're very thankful that they got the treatment. There hasn't been any side effects. They feel a lot better. They're asking, oh, can I get out of my quarantine or isolation? No, you cannot. You still have to stay in your isolation, but we're very happy and very grateful that you are feeling better. So please get the treatment early if you are positive, and go get tested if you're having symptoms. So, we're all doing this, and you can see that the hospitalizations are going down. They're trending downward, and we hope that the monoclonal antibodies that are being given to these patients are making that difference in not overwhelming our hospitals.
Wow, Dr.
So I
Cruz.
think it's been a very good. So I'm Dr. Palmer. I'm going to be taking over the site here today.
Okay.
Yeah.
So is Dr. Palmer from FEMA?
Transition. Yes, he's Dr. Palmer from FEMA, and I'll be observing. They came to see what our processes are yesterday. They took turns doing all the different areas, different roles, and now I'm gonna observe and let them jump right in and start treating more patients.
Dr. Palmer, Dr. Cruz, Dr. Cruz, I know you mentioned that you guys are up to around 50 to 20 treatments a day, and when we opened this infusion center, you said that was around the capacity. So are we anticipating opening maybe another infusion center? Either of you, if you could?
That's not quite capacity of it.
Yeah, so that's not quite
Okay.
capacity, but if the demand is there, we will open other infusion centers or treatment centers.
Mm.
And again, this is a injection just underneath the skin. So it's not an infusion here.
Mm.
So it's more convenient for the patients. We can treat more people in a more efficient manner. So that's why we're giving it subcutaneous or just underneath the skin.
And the bioavailability is just as good too. So
Yeah, meaning that the effectiveness of the treatment is just the same as being given through IV. So IV or subcutaneous, they're both very effective at helping you feel better, preventing serious illness, and preventing hospitalizations.
Dr. Palmer, have you worked at any other infusion centers, I guess, anywhere else in across the country?
well, I mean, in my private practice, yes, I've been doing these since November. So we've only been doing IV infusions, but like even last week, I had 5 patients that tested positive that I ended up treating with the monoclonal antibodies, and they had good outcomes. So I would say, all in all, at least probably over 100 or more. Since the spike, it's become a new. There was a time when we didn't treat it as much in cases, but more recently it started to come back, and yes, it's been definitely proponent.
Hey guys, they're gonna have to start opening
Okay,
here pretty
okay.
soon.
Right, yeah.
Thank you.
Thanks,
But
thanks
yeah.
Mark.
Thank you guys.
Yeah.
Our
Appreciate it.
Daniel Perez, he interviewed some of the members of the FEMA team, and he'll have more on that story tonight on primetime.
Daniel's actually hustling in the
Yeah,
background.
I just saw him give Dr. Cruz rock.
Right, but Mark, we also wanted to talk to you about the booster shot and
Yep.
and the clinic over at UOG. We understand that it's already fully booked.
Sold out.
Right. I guess
Yeah,
that's a good
that's right,
thing.
guys, and that's encouraging. So out of about 600 available appointments, you're good, Daniel? Thanks for coming down. We appreciate you. Good guy. Out of about 600 appointments that were available, they were all booked yesterday by the mid-afternoon, which is a good sign. There's still some space available for walk-ins, but the walk-ins should know that the wait time will be a little bit longer, and there's always another day. You can make your appointment we're open every day of the week except Thursdays and Sundays. So go ahead to tinyurl.com/VaxGuam, and it's real easy. You can do it on your phone. There's big orange buttons to help you navigate. And again, you can walk in too, but just be prepared to wait a little bit longer.
And you can wait. You guys are accepting walk-ins?
Yeah, we're accepting walk-ins, but we honor the appointments in the hour that they were made
Right.
for, right?
Right.
So, if it's the same thing, guys, that we went through earlier in the year when it was real busy.
Mhm.
If there's a long rush at the opening gate, people want to line up early. I mean, it's okay, but it just increases the wait times, right? We can only accommodate so much, even though we've made full use of that field house floor. There's only so many we can put through per hour.
Mhm.
So we do encourage walk-ins. If you must walk in, come in throughout the day. Come see us later in the afternoon. That's generally when it's not as busy and the wait times aren't as long. Or just
Mhm.
make an appointment on another day.
Now when you look at the criteria, we're looking at older people, a lot of older people that are going to be coming down there. Some of our Manumco. Is there anything they should know before they head over? Should they bring water? You guys going to have chairs for them, wheelchairs, golf carts.
Sure. Great question, Bree. Thanks for that. So first thing, on Wednesday, we do a separate drive-through clinic. This is across the parking lot from the field house at the UOG cafeteria. You know that little drive-through area? It's like a porte cochere or whatever fancy name when you drive through and there's a doorway there. Yep. Every Wednesday at 9 o'clock, there's a drive-through clinic for the folks with mobility issues, to include Manumco.
Mm-hmm.
So you can make an appointment there by calling 311 option 2, talk to Guam Cedars, and they'll take you at the drive-in vaccination clinic at the cafeteria. If you don't want to wait until Wednesday, or Wednesday at 9 in the morning isn't good for you, then you can still come in to the normal hours at the field house itself. And yeah, of course, bring your water. We do have a little bit of water, but not enough to accommodate thousands per day.
Right.
You know, there's enough seating. There's a golf cart for people who want to ride if you park far. There's wheelchairs available there too for people with mobility issues. And we're going to accommodate you as best we can. Now, it's important, Chris and Bree, to say that, yes, while the availability and the eligibility is open for the booster shot now, let's do what we can to allow the Manampu to come in first. I like to think of it like the fiesta table where, yeah, you're young and healthy and you could run up and eat first if you want. But normally what we do here is we allow our Manampu to go first. So that's kind of the tone here. Instead of the phased or the tiered approach that public health put out when we first rolled out the vaccine, we're doing a courtesy respect system here. So let the Manampu, let the healthcare workers have a first crack at it, and we'll all get our turn.
Mm-hmm. And they need to bring their vaccination card, right, and an ID.
Yeah, bring your IDs. If it is for booster shot, or even if it's your second dose, of course, bring your vaccination card so we can update it, make sure you're good to go.
And there's no prescription needed to get the booster shot, right?
Correct. It's verbal attestation.
Verbal attestation. Okay. What time is the clinic today? 11 to what?
11 to 5, Bree.
Mm-hmm.
The last appointment will be at about 4:30, but the operating hours are from 11 to 5.
Mm-hmm.
And that's true for every day except Thursdays and Sundays when we're closed.
Is the monitoring period still the same, about 15 minutes?
That's a good one. You know what, Bree? I don't know. I think so, but let me ask them over there, and I can actually text you back with that answer.
Okay. What'd you say?
Mark, what's the capacity over there at Manila? If it's not 15 to 20.
No, this is
If it's not 15 to 20. You're talking about how many?
Yeah.
Shoot, man, Denise sent me those numbers.
Okay, this later's fine. Sorry.
Look at it this way. Back when, back in the heyday earlier this year when it was real busy there, we're capable of putting through over 2,000 a day. It's the same configuration as it was before. We have the staff ready, but our appointments right now are at 600 per day with the allowance of some walk-ins. So whatever we see today, I'm confident we can face it and we're ready.
Right on.
And again, just so people are clear, the clinic over at the field house, right? It is only for the booster shots today, not people trying to seek their first or second dose.
No, come and see us. If you haven't been vaccinated yet, or you need your dose too, you need your additional dose, which is different from booster, or your booster. Just come see us.
Okay. All right. Anything else, Mark?
Thank you guys for helping put this word out. We appreciate you. Thanks to the people of Guam.
No, thank you.
If you choose to get vaccinated, if you're able to, please do so. We'll be there.
All right. Thanks,
Appreciate it, Mark.
Thanks, guys. Have a good one.
Stay safe.
Right on. It's 8:49. Let's take a really quick break, guys, and come back with more of the link next. Good morning.
We know you're tired of hearing about COVID-19. Some of you are probably wondering whether this is ever going to end. However long it takes, we all have to do our part, including our children, to hold the line. You can protect yourself and your family by getting vaccinated.
And if you're